Good evening from Look East. First tonight, calls for new guidance on a prescription drug after the death of a Cambridgeshire photographer. As a teenager, David Chow was prescribed Roaccutane to treat his acne. He soon began to suffer severe side effects, which often left him unable to talk or eat due to severe pain. When 2 operations and further treatment failed to cure his condition, he took his own life. A coroner was told there was no doubt the drug caused his problems. Alex Dunlop has been talking to Mr. Chow's family.
At her home in Bury St Edmunds, Joy Chow proudly shows me her son's work. 5 days after Christmas, the acclaimed photographer locked himself in his parents' bathroom and fatally stabbed himself in the chest.
It was absolutely shattering. It was unexpected as well, because David had been through so much.
He had had problems, but he always came through them. He always had the courage to take a step back, recover, and find something new to do.
At 17, suffering from mild acne, David was prescribed the drug Roaccutane. Within days, he suffered from swollen, crusted lips and infections. They never cleared. He couldn't talk for long and had agonizing jaw pains. His parents are convinced his death was a direct result of taking the drug. Roaccutane has helped thousands of people who have acne, but figures show 1 in 10,000 will experience serious side effects. The UK drugs watchdog has recorded 47 suicides connected to the drug since it was first licensed in 1982. In a statement, the drug's manufacturer Roche said a British medical journal concluded there was an increase of attempted suicide during and after treatment with Roaccutane, but this additional risk is most likely due to the acne rather than the treatment.
Anything between sort of 10 and 25% of people with skin conditions can be at risk of developing significant levels of psychological distress, and a very small proportion of those people can be at risk of having suicidal ideation and going on to, unfortunately, take their own lives.
I feel, how many suicides do you need in the statistics before somebody takes some real sort of look at this drug and what's happening? And David was a lovely, wonderful son, and it was so out of character, really, for him to do such a drastic act.
Joy Chow ending that report by Alex Dunlop. So where does this leave others who've been prescribed Roaccutane? Well, our reporter Wasim Mirza is with us. Wasim, what have you found out?
Well, the government's health regulator says Roaccutane remains under close review. It says patients who've ever suffered with depression must tell their doctor before taking it, as the drug can make those feelings worse. I've been talking to a GP who also runs an online medical forum for patients. She says she gets lots of questions about acne from people whose doctor doesn't seem to be taking their condition seriously enough. She says there's a bit of a postcode lottery for this condition, but when it comes to Roaccutane, she says it's not the drug for everyone, and patients should always watch out for side effects.
If they start feeling any symptoms of anxiety, depression or suicidal intent, something really serious like that, then they need to get to see their doctor as soon as possible. And sometimes not just not stopping the drug isn't enough, that sometimes they need specialist psychiatric help as well. But we've got to get it into perspective that these very severe outcomes, and it's very, very sad for this case in Cambridgeshire, really sad, but luckily they are very rare.
Now, there are patients who say it's a miracle cure, and even David Chow's father isn't calling for a ban, just tighter controls on who can take it. Now, if you want any advice, the British Skin Foundation has a leaflet about acne, or there's an online forum at talkacne.com.
Wasim, thank you.
I'm going to do a poo in a minute.